Good evening, wonderful people. Welcome to this evening's session. It's a delight to have you all with us, and we cannot underestimate your importance to this program. This is World Antimicrobial Awareness Week, celebrated from 18th to 24th of each year, of November each year, and today marks one of the sessions in commemoration of 2023 World Antimicrobial Awareness Week. And today we are looking at consumers and the connection to antimicrobial resistance. Do we have a role to play as consumers? We are all consumers, and we have to look at how the connection between us as consumers goes with the issue of antimicrobial resistance in the world today. This program is jointly organized by the Ghana College of Pharmacists together with CES and under the kind sponsorship of the WHO. And we are very happy to be part of today's sessions. We start with an opening remarks from the rector of the Ghana College of Pharmacists, and she's in the person of Madame Yvvonne YirenKyiwaa Esseku. So, Madame, with a short prayer, which I'll quickly do, that we thank you for this opportunity, Lord, that we will learn today as children created by you to make the world better. We ask that you make this program a success. We thank you once again, our Father and our God. We welcome the rector of the Ghana College, Pharm Yvvonne YirenKyiwaa Esseku Esquire, who happens to be my rector whilst I was in college. Welcome, madam. And can we have the opening remarks from you? Thank you.
Thank you so much. Thank you. And yes, a very warm welcome to you. Thank you, Pharmacist Enyonam, for your kind words, for your great introduction. A very warm welcome to all of us to this meeting. This, as we have been told, is the second in a series of webinars brought to you by the Ghana College of Pharmacists and with support from the WHO. Yes, powered by CES. So a warm welcome to you. In this series, what we are looking at achieving, hopefully, is that we will engage every one of us, because a theme for this year, and it was the same for last year, for the World AMR Awareness Week, is to see how we, all of us together, can fight antimicrobial resistance. And so we are looking for opportunities to discuss among ourselves as healthcare professionals, as consumers, and as stakeholders in the health of our people and of ourselves, to see how we can contribute to this fight. And so to do this at the Ghana College of Pharmacists, as I mentioned, it's a series. This is the second in the series, and we hope that you can join us again another time when we call on you. To do this, we have put together a strong panel of experts and practitioners in medicine use and in antimicrobial resistance and antimicrobial stewardship, antimicrobial consumption, antimicrobial use. And we have brought these people together to lead us in these discussions. We are counting on you that you will pay attention, you will make notes, you will put your thoughts together, you will put your comments down, and then when the time comes for us to discuss, when the portal is open for all of us to make contributions, you will make contributions, you will ask questions where it is not clear. Then when we have finished, all of us would have made some commitment based on the knowledge that we have acquired or the reminders that we have received. We make commitments to ourselves and to one another that we will each put our shoulder to the wheel to fight this global menace of antimicrobial resistance. And so once again, thank you for joining us. Enjoy the meeting. Learn as much as you can. Ask questions. Ask questions and make all the comments with respect to your experiences and how we can all contribute in this fight. Thank you.
Thank you very much, Madam Rector, for this wonderful opening remarks. And audience, like you've rightly heard, this evening promises to be very insightful, empowering, and it also will bust the myths that we have regarding antimicrobials. So our first speaker, we quickly zoom into the presentations. And like Rector said, we believe you are paying attention with a very rapt attentiveness, and you will carry on with the notes. And then when the questions come, you will ask. So our first speaker is from Francisca, Dr. Zigah. From Francisca is a clinical pharmacist. She's an infectious diseases specialist at Kolebu Teaching Hospital, our premium teaching hospital. And she has over 2 decades of clinical experience. She is a clinical preceptor, an adjunct lecturer with universities and professional colleges. And she's also a clinical research and clinical trial fellow from Johnson & Johnson Infectious Disease Global Public Health Institute. She is a principal investigator for dengue fever, and that is currently ongoing in selected hospitals and communities across Ghana. From Zigah completed her Pharm, MSc Clinical and Social Pharmacy, and PharmD at KNUST. She holds an MPH from the University of Ghana School of Public Health, and she is a research and clinical trial fellow, as I've already indicated. From the Belgium, she received that fellowship from the Johnson & Johnson Pharmaceuticals in Belgium. She's also a fellow of the Ghana College of Pharmacists. Francisca has extensive experience from various healthcare delivery settings, involving interactions with a wide profile of healthcare professionals. So this evening, from Zigah will take us through the presentation on how antimicrobial resistance occurs. The floor is yours, from Zigah.
Good evening, everyone, and thank you very much, Enyonam. I'm so delighted to be part of today's discussion. And as Enyonam has rightly stated, and the rector has also indicated, this week is actually dedicated to antimicrobial resistant awareness creation and education. And I will keep the ball rolling with my session. I will be discussing or leading the discussion on how do antimicrobial resistance occur. For us to be able to understand this very well, what do we know by antimicrobial agents? Antimicrobial agents basically are medications that we use to treat diseases that are caused by germs or microorganisms. These microorganisms are foreign things that are usually living outside but can find their way into our system, and then they cause us certain diseases. So medications that are usually used to take care of or treat this kind of infections are what we term antimicrobial agents. This microorganism that we talk of, they usually present in various ways. We have one that is called bacteria. Bacteria are very common. We have another one that are viruses. They are also very common. We have fungal, and then another one, protozoan. Protozoan example is the germ that actually causes malaria. So all this put together, bacteria, viruses, fungal, protozoan, and these germs, we cannot see them with our naked eyes, are the things that actually cause infections, and that can actually lead to serious diseases. So we human beings, animals, when we have this diseases or infection, we tend to use medications to treat those infections. And those medications are what we refer to as antimicrobial agents. Anytime that there is a use of something, we also have the disadvantage of it. And for antimicrobial agents, we tend to have these microorganisms developing resistance. Resistance in a sense that the microorganisms would not, or the medication that we are using to treat the microorganism will stop working. The germ will strive in spite of you taking the right medicine. And we have come to know that we, the consumers, are one or are the main leading cause of this resistance development. We are the cause of making the medication becoming ineffective in treating these diseases. How does it come about? This usually come about when we have situation whereby there is an overuse of these medicines, or there is misuse of these medicines, or there is mistreatment of an infection that is caused by the germs. What do I mean by overuse of antimicrobial agents or medicines that are used to treat this infection? In a situation whereby one happens to get an infection from a virus, and then one decides to use an antibiotics over and over again to treat a viral infection, an example which is a common cold, this would eventually lead to resistant development. The microorganism would not work. The medication that we are using will eventually become useless and would not be able to kill the microorganism that we are targeting. And then another situation where people, especially farmers, also find themselves is they tend to use this antimicrobial agent, these medicines, in the farm animals. That also leads to overuse. We tend to have residuals of these medicines in the farm produce and products. And this eventually also leads to the microorganism becoming stubborn to those agents that are used. It happens in the fishery farming as well. That is the situation where we have overuse of antimicrobial agents. In situation where we have underuse of antimicrobial agents is, yes, you have fallen sick. You've been given an antibiotics, you've been prescribed an antibiotics, and you've been given those antibiotics or antimicrobial agents to take. Treatment duration is supposed to be for 7 days or maybe up to 10 days. You started the medication, within 3 days, you are fine. All symptoms are resolved. And usually, human being as we are, we tend to stop taking the medication. That is underuse of the antimicrobial agents. This situation can also lead to the microorganism becoming very stubborn. And when you start taking the medication rightly, it would not work. That is underuse of your medication. Another situation that we consumers also find, medication is supposed to be taken 3 times in a day because that is how the medicine would be able to do its work. But we find ourselves whereby we take the medication just twice a day or once a day. We feel a bit better and then we think we are okay. Not using the medicine rightly, that is also underuse of the medication, and that can also lead to resistant development. Then we also have a situation whereby we misuse the medication altogether. someone has been given an antibiotic for a symptoms or a disease that he or she presented to the hospital with, the leftovers, you started presenting with the similar symptoms, then you go in for some of those antimicrobial agents. You are misusing those drugs because you can't tell whether those agents, the medicine that you are using, would work for your condition that you are having. In those situations, we say that you are misusing the medication. So it's very important. Anytime we have infection, it is very good we report to the right health authorities for them to prescribe the right antibiotics or antimicrobial agents for us. And when that is done, we have to take it well and complete the dose. When that is done and done very well, the issue of drug resistant, antimicrobial resistant development would be minimized. It's very important because as we speak now, that there is no enough medication to treat common infections that we have with us, mainly because the ones that are available, we have misused them, we have overused them, and then there is gradually development of resistance or the risk development of resistance. And there will come a time, which is, I'm sure not too long, that we will have a situation you wouldn't have antibiotics, you wouldn't have antimicrobial agents to treat common infections that usually affects our daily lives. So, very important again that we human beings are the contributing factor, or we facilitate the development of antimicrobial resistance. And we all have an important role to play to halt this situation that would eventually become a worldwide pandemic. When that happens, you have, as I said, a common simple infection. It could be a toothache, that's all, yeah, that gets infected, an ear infection, which is very simple, a urinary tract infection. All these things we would not have a good medicine that we can use to treat it because we have overused, we have underused, we have misused the available antimicrobial agents that we have for use in us. So I will stop here and then we would continue with the discussion.
Thank you very much, from Zigah. A little correction. I've been clearly notified. Dr. Zigah has a master's in clinical pharmacy, not clinical and social. So she has clearly given us a very nice acronym. Oh, man. Overuse, misuse, underuse, and mistreatment. If you remember nothing from Dr. Zigah's presentation, we remember, oh, ma'am. Thank you very much, Dr. Zigah. So the next presentation is on self-medication, the topic of self-medication. And this will be taken by Pharm Appiah. Pharm is a pharmacist by profession. She is the executive director of Equity Pharmacy. I'm sure for those who know Equity Pharmacy, you know that Equity Pharmacy has a standard in community pharmacy provision. She holds an MBA, and also she's a member of the Pharmaceutical Society of Ghana. She is a facilitator for Academy for Women Entrepreneurs, that's YALI, in the Regional Leadership Center, West Africa. Pharm is a very versatile woman, and I really admire this great professional. Without much ado, I would welcome Pharm Appiah to take the next slot on self-medication. Audience, your presenter. Thank you.
Hi, and thank you very much for the exciting introduction. Ajwa Esseku, as I call her, I'm sure she's laughing at both sides of her mouth for seeing me during this presentation because I always shy away from my responsibilities to give back in this manner. So once again, I'd like to thank everybody for dragging me here, and I hope my relevance in terms of outputs will be felt. My responsibility here this evening is to talk about self-medication. And in the community pharmacy where I've worked for over 20 years, we see practice day in, day out. And in order to share what I have to say, I would like to share a story. So imagine at 10 a.m., Ajwa, who is 30 years old, comes with one child strapped to her back with a cold, and two children aged 3 and 4 also with a cold that just started a week ago. They all go to school, and according to Ajwa, who you can see is almost in tears because she's clearly overwhelmed. This has been happening over and over again over the past 6 weeks because one of the children has just started kindergarten. So when you are faced with this, and Ajwa comes and she says she's holding a bottle of amoxiclav 475 suspension, and she wants her children to be well so that the children can go back to school, so that she can go back to sell her tomatoes in the container. And she has been there the week before, and she can't comprehend why we're not giving her the antibiotic she wants, especially as her assemblyman has reassured her that that's the way to go in terms of how to make her children well. So these are what we face in the pharmacy day in, day out when it comes to issues around self-medication. So in order to contextualize self-medication within antimicrobial antimicrobial resistance, as is the task, it's important to know what it means to self-medicate. So I went, and some scholars, I'm sure, like Pharm Zigah and the other big scholars like the professor, put together on some other platform. It says that self-medication means taking medicines on one's own initiative by oneself, or as suggested by a friend or another who is not a certified medical professional. You would wonder, why would you want to take medicine that you haven't been prescribed, or you haven't been suggested by somebody who knows what the medicine is? And it's important at this stage to understand that research has shown that the most common and obvious contributing factor to antimicrobial resistance is self-medication. So there are reasons why people self-medicate. These days, new media promises us heaven. Dr. Google is always available to give you a solution to your problem. So people quickly input symptoms, and the system or Google generates solutions. So once solutions are generated, people who now feel like they can do everything by themselves feel they don't have to go to any professional or go to the doctor or go to the hospital where there's a long queue, which is probably a waste of time and too expensive. Decide to go to the first point of call, which is the pharmacy or the over-the-counter medicine practitioner, who, as we know, in theory, is not supposed to give out antibiotics. But in the community and the system within which we operate, antibiotics are given out as freely as bread and butter or tomatoes in the market. So therefore, these are some of the reasons why people self-medicate, because they're given suggestions by people they trust, and they are comfortable with new media and the fact that it gives them the solutions they've been asking for. And also because they feel going to the hospital or seeing a professional is a waste of time. So they go through the DIY route of doing it yourself. And of course, COVID, as we are all aware, kind of catapulted most people into the abyss of self-medication, ranging from the antibiotics, people weren't unsure, everybody turned into a doctor, and we're doing all sorts of things. That kind of put us in the abyss of antimicrobial resistance. So now that we know the definition and we know the reasons why we do this, as stewards of medicines and as friends of the human race, it's important that we offer or proffer solutions and attach ourselves to a call of action in terms of what to do to reduce this. It's important to note that we should not slow down in our efforts. We shouldn't sit down. We should, every time somebody comes, whether they are buying antibiotics or whether they're buying anything from the pharmacy, or every opportunity we have, it's important to let them know that the scourge is upon us, it's with us, and we need to set up, we need to take this head on, because we need to make the decisions ourselves to overcome the scourge of antimicrobial resistance. And we need to know that it is a fight that is continuous, can't be done in one day. And we need continuous public engagement like we're doing now. This is a step in the right direction. We need to do it more often, not only when there's the week of celebration and public awareness like we're doing. And then we need to consciously erase myths and misconceptions. We need to use the tools that everybody uses now, like new media. We need to, as friends of the human race, as pharmacists, we need to own the fight. We need to go up there, even if we need to take up Instagram posts or go on to when people make posts about medicines that they're advocating for people to take, not sit on the fence, but be more than advocates or soldiers against antimicrobial resistance. And every opportunity we get, we need to reiterate that it is a scourge, it is something that affects everybody. Because if the medicines don't work, the effects of prolonged illnesses, people cannot they can't they can't work like they should, and the risk of adverse reactions are one of the few effects of self-medications that have resulted in antimicrobial resistance. And so it's it's a call to action. It's a responsibility. We can't sit on the fence any longer. We should do this all the time, day in, day out, whether the person is coming for antibiotics or not, whether the person is whether the person comes or whether the person is doing stuff that they shouldn't do. So at this point, I would like to take my leave and open up for any questions that may arise. Thank you.
Thank you very much from Nanaya. And we are very grateful for this eye opener. As a public, we all know that, as from the WHO site, I'll pick this, it says antimicrobial resistance is a threat to humans, animals, plants, and the environment. It affects us all. Pharm Anaya has said it. It affects us all. And while she was making her delivery, wonderful delivery, I remember that song on social media, never Google your symptoms. So self-medication is not encouraged. The various reasons she has spelled it out. However, if we all want to put our hands to the plow and stop this menace of antimicrobial resistance, then we have to take all the points that have been clearly enumerated very seriously so that we can stop this menace before it goes out of hand. Thank you very much from Nanaya. And the next in line is the presentation on discontinuing antimicrobial medication. And this will be taken by a very wonderful lecturer of mine whilst I was in school. And even up to today, he's still like a great leader in our professional line. He holds he's a clinical pharmacologist and a professor of pharmacy practice. In fact, his accolades are so long that if I start to take the whole time. However, there are a few things I need to point out. That he is a fellow of the Ghana College of Pharmacists. He's also a former experiential training coordinator, a former head of pharmacy practice, former vice dean in the Faculty of Pharmacy and Pharmaceutical Sciences. He's the current dean of the School of Pharmacy, University of Health and Allied Sciences, UHAS in Ho. He is responsible for training specialists and fellows in pharmacy in Ghana. And he is also a lead. He is a lead in he's a deputy chair of the multi-stakeholder, multi-sectorial antimicrobial resistance coordinating committee or platform in Ghana. He is a technical working group lead, yes, on the antimicrobial stewardship in Ghana. And he's also a consultant to teach antimicrobial stewardship, ECO Initiate. He is also in a collaborative project between Ministry of Health Ghana, the University of New Mexico, and Pfizer. You can see his accolades are many. In fact, all this he's doing with the University of New Mexico and Pfizer is to strengthen antimicrobial stewardship in health facilities in Ghana. So I can say that we are in a very good position to be steered this evening the topic on discontinuing antimicrobial medication. And so, audience, I present to you Prof. Kwame Ohene Buabeng for this particular topic. Prof, please, the floor is yours. Do we have Prof? I think there's a little technicality here, but it will be rectified soon. Prof. Buabeng will join us in a while. Yes.
Hello,
You're
can
welcome.
you hear me now?
Yes, Prof,
much.
you are loud and clear.
Thank you, Enyo, for your kind presentation. And I want to thank the rector of the Ghana College of Pharmacists and also the colleagues here for a wonderful job that they are doing. Thank you, rector, for the opportunity. I am very, very happy that we are actually discussing the subject matter. Francisca has already laid the foundation. We are dealing with, in fact, a problem which is actually bigger than COVID-19. I mean, COVID was a major pandemic, and all of, but this is a silent pandemic. It's a big global problem, and like Enyonam said, it's clearly has been described by WHO as a major, global health threat. However, all hope is not lost. As we get to understand more about this and we take steps, we are able to deal with this menace. And Francisca has already established, that now antimicrobial. We're talking about antimicrobial resistance, and the antimicrobials that are actually used in managing these microorganisms that causes serious infections and, in fact, life-threatening. Oftentimes, these antimicrobials are actually life-saving. They're life-saving medicines. So if we use it, we use the right antimicrobial, we use it in the right way, the right concentration, that would either suppress the growth of the microorganism or destroy the microorganism and treat the infection. We minimize the risk of resistance. That if we don't do that, that is, and I think Francisca has explained that, then they find a way of becoming resistant, and they do it in diverse ways. They can sometimes develop enzymes that destroy the microorganism, completely. They are able to sometimes, throw out the drugs, the antimicrobial agents from their system, and many others. But if they are used very, very well, we get good outcomes. The topic I am dealing with is discontinuation of antimicrobials. Now, as long as we have the organism causing the infection, and as long as the organism has not been destroyed by the appropriate antimicrobial, you don't discontinue, the treatment. Because if you discontinue the treatment, then you give the organism the chance, to develop various means, right, of becoming resistant. Some of them can even form a coat around it and prevent the drug from penetrating. Or as I said, produce enzymes, to break the microorganisms or to bring it out. So if the infection has not been successfully treated, and how is it done? Usually, clinicians evaluate the problem and see that, oh, this is the infection that this patient is having. It is caused by this microorganism. We need this type of antimicrobial agent to treat the infection. He needs this dosage. You need to take it this number of times. All the drugs are different. Some are taken daily. Some needs to be taken 3 times a day by virtue of their nature. That is the way it can destroy the organism. Some has to be taken, for 3 days. Some has to be taken for 5 days. Some has to be taken for 7 days. It all depends on the infection that one is having. And for that matter, it is extremely important that one actually take the treatment for the period that the drug has been prescribed, because that is what has been determined scientifically, all right? At the right time to really destroy the microorganism and treat the individual of the infection. If we are able to do this, it's like magic, because infections really make people weak, very, very, very sick, and once you get the right treatment, within a short time, you realize that, the individual is very well, like Nanaya rightly said, very strong, very productive, etc., etc. But if the treatment is not apt, it's not appropriate, it's not adequate, it's not, enough to take care of the microorganism, and if one decides to just stop, one started the treatment, and once he's getting well, he started to stop. If you do that, you still have remnants of the microorganisms in your system, and they can become, they can develop resistance. And when they develop resistance, we need to find a way of using newer antimicrobial agents that would be effective against the resistant microorganism. And certainly that will mean more money. Sometimes it means more adverse effects. So you don't discontinue the treatment. You take the treatment till the end, where we have successfully eradicate, because that's the goal, eradicate the microorganism or render it completely useless for the immune system to deal with it. And once we are able to do that, then we minimize the risk of the emergence and spread of antimicrobial resistance. Francisca said that, if we are not careful, we stand the risk of not having effective antimicrobial agents, antibiotics, antivirals, anti-parasitic drugs, etc., etc. And that is very true. However, if we use the ones that we are having, we use it very well. We use it for the period, the period that has been prescribed for. We are able to deal with the infections very effectively. Then we preserve the lifespan of these life-saving, essential, medicines, and then certainly infections can effectively and easily be treated. One of the conditions that is easily treatable and curable are infections. Once we get the right antimicrobial agents, we use the right dosage or concentration and adequate period of time. So antimicrobial agents should not be discontinued, all right? When clinicians have not access. And then also, when we have finished treating the condition and the condition is fully treated, there is no need, to continue to take the antimicrobial agent. That is the time that we need to stop. And then, when the infection has been, or the sickness has been very well treated, don't, start taking antimicrobials thinking that, antibiotics are very strong medicine. So anytime you see any sickness, you go for it. All sicknesses have a cause. If it's an infection, we need to know the cause. And we need to use these important life-saving medicines, use it well, use it appropriately, and we get the best of outcomes, from it. And we minimize the risk of infection and preserve the lifespan of the antimicrobial agents that we have, minimize the spread of antimicrobial resistance. I think I also want to end here. I'll be available, for the question time. Thank you very much.
Thank you very much, Prof. Buabeng. Very, very, very insightful session with us. And we have taken this home that don't discontinue treat. Otherwise, we will let the organism call for reinforcement, and it becomes difficult the next time to be useful. Thank you very much. Now, next presenter will take us through infection prevention and control. And to do this is a pharmacist, a lady pharmacist. I think today the ladies have really dominated the session. And so we have a lady pharmacist, very hardworking one, self-disciplined, a dedicated woman, currently the hospital manager of Port Medical Center. She holds a B.Pharm from the Faculty of Pharmacy and Pharmaceutical Sciences, Kwame University of Science and Technology. She also holds a PharmD from the University of Ghana School of Pharmacy. She holds a clinical leadership and management certificate, a master's from the University of Ghana Business School, and she is the immediate past president of the Lady Pharmacist Association. She is also a member of the Zonta International and the president of Zonta Club of Tema. That's from 2019 to 2023. So it's on her heart to make any contribution for public good. So for this last session, not the least, we call on Pharm Naana Afia Aboagye-Asare to give us the presentation on infection prevention and control. Pharm Naana, if you are on, the floor is yours.
Thank you very much, Pharmacist Enyonam. I think for me, the most important introduction from her is the fact that she's also my classmate and yearmate. And actually, when we were in the university at some point, we were roommates as well. After those three powerful presentations by my seniors, Prof. Buabeng, Naana, and Francisca, I can only say that I'm privileged to be part of this team to talk about antimicrobial resistance and awareness, especially to the public. In the next 5 minutes, I just want us to understand that after all that they have said, it seems to look like they are talking more about what the health experts tells you and what the health experts want you to do. I want to talk about what you as the consumer or as the public can do to help us in this case. The first thing is the fact that if you are not sick, you do not need medication. And thankfully, there are a lot of things that we as individuals, wherever you are, taxi cab, market women, housewives, children, fathers, mothers, can do to prevent us from getting sick. And so we can also do our quota to prevent this antimicrobial resistance that is creeping in and is becoming a slow menace, as we have all been told this evening, and making it very difficult for simple illnesses and simple diseases to be given a one-shot empirical treatment and then it goes off. So what basically is infection prevention and control? What we are just saying is that there are things that we do, we can do, while within our power, our enclave to do, so that we can prevent ourselves from being sick, from getting the germs, from getting the bugs, and then needing antibiotics. First on the list is hand washing. COVID told us very well, classical case, that hand washing was very important when we want to prevent any infection. And I believe that even though we do not see the crisis of COVID as we did in 2020 and 2021, we have not left our hand washing skills, which we learned in those years, away. It is still very relevant for us now that we engage exclusively in hand washing. We engage in it any point that we are washing our hands when our hands are dirty. We are washing our hands before we cook. We are washing our hands when we come back from outside and go into our homes. We are washing our hands after we use the washrooms. We are washing our hands when we feel that there is dirt. In the absence of hand washing, we have what we call the alcohol-based sanitizers. And thankfully now they are plentiful and they are everywhere. However, I must add that when you keep using the sanitizer for a bit, and then you now realize that even when you rub the sanitizer in your palms look dirty. It's time not to continue to use that sanitizer. Actually wash your hands with soap and the running water, because that is the most empirical way to prevent you from getting any disease. The other thing that we have to look at again is cleaning, or especially in our homes and in our offices. And for all of us, everywhere that we are, the market woman, in the shop, in the store, if that place is your office, is to try to clean the unlikable places that we think. We see a lot of people, and then when you go into a home, people are just cleaning. We clean a lot of the countertops, we clean a lot of our tables, we clean a lot of our sinks, but we forget things like our doorknobs, we forget things like our fridge doors, and all those things have to be cleaned, because those are places that we touch as well. And so we should just not be looking at just cleaning our surfaces and mopping the floors, but we should look at cleaning our doorknobs. We should look at our door handles. We should look at our fridge handles, our microwave handles, etc. Talking of fridges, I'm not too sure how many of us have even cleaned our fridges the whole of this year. It's one area that can breed because of the temperature differences. We open the fridge, a temperature difference goes in, and then of course we also live in Ghana, where we can get power outages. Our lights can go off, our temperature in our fridges fluctuates. We put food in, and then we can get all sorts of germs and all sorts of things happening. One way to help us keep not just the freshness of our food, but also to keep the germs away, is to actually keep our fridges clean. And so we are looking at cleaning our fridges. Things and other equipments like our microwaves, like our air fryers, and all those things have to be cleaned. We just don't keep using them. Put a clean plate in a dirty microwave, it is still going to get you the same thing. So as you are cleaning your plates, you are washing your dishes daily, occasionally and regularly. Those are electrical appliances that we use, our blenders. Let's not just clean just the receptacle that we put the things in and then we just blend, but occasionally clean the whole setup. Get a lot of the dirt out, and you'll be amazed at the kind of dirt that's in all those crevices and things that we have. So let's do that cleaning. In terms of our personal hygiene, the dentist says, so from your head to your toe, we are looking at having baths. The dentist says at least once every 3 months change your toothbrush. I can appreciate the economy, and I can appreciate sometimes it is a little hard. I mean, toothbrushes used to be like 2 cedis, now they are like 10, 15 cedis if you want a good one, and even higher. But we can still do our good old chewing stick, put on your fluoride toothpaste on it, and it can still work wonders for us. If you feel that changing your toothbrush every 3 months, which is 4 times a year at least, is a little above your pocket for you to do, then let's look at other alternatives. We can do the chewing sponge with fluoride. We can do the chewing stick with fluoride. But it's important because we keep putting this in our mouths and then putting it down. There's a lot of moisture that goes onto the toothbrush that it dries off. It's a breeding place for germs, and so it's one of the things why the dentists keep saying that let us change our toothbrushes. We are looking at cleaning ourselves. Another important piece, which a lot of us do not take sign of, especially in our homes when it comes to infection and prevention control, is what in my local language we call entomago rags. By virtue of the fact that we use it to clean dirty spaces in our house, the rags quickly becomes dirty. The color may fade, the thing becomes more brownish, even if it is white. However, we have a tendency of not keeping rags clean, putting them in places where it gets beaten by rain, where it gets damped. But then when you have a spill in your living room, in the room that you have cleaned, in the bathroom that you have scrubbed, it's the same rag we are going for. And we are just going to introduce extra germs from these things back into places that we have cleaned. And so this evening, the advice I want to give is that let's keep our rags also clean. It's a valuable thing that we need in the house to keep the spills away. And so we do not need to introduce dirt. We do not need to introduce germs when we are bringing that in. Another important thing that we have to also contribute, and we also have to consider when we are looking at infection and prevention control as the consumers, is that we also need to realize that when one is sick, it is not that people do not want to be together. We are Ghanaians, we are very sociable, we are very huggy people. We love to hug our neighbors, we love to shake hands and all that stuff. But then when somebody has a cold or when somebody has the flu, etc., and then the person is trying to, it's not that the person is just trying to not to be friendly, but it's better that way so that the person tries not to spread the illness. COVID has taught us that. And there are things that we shouldn't just say that COVID taught us and COVID is no more, as we know it, and so we don't use them anymore. So occasionally you may want to wear a mask because you have a cold, but it's not because you have COVID, because you still understand that in protecting yourself and your loved ones, you just have to break that barrier, that transmission risk of spreading the disease. And so in a nutshell, infection prevention and control, it begins with us. Our mothers, with every single one of us, we are looking at yourself. When you talk of infection, look at yourself, look at the things that you do by keeping yourself clean, having regular baths, washing your clothes when they are dirty, using and cleaning your surfaces, cleaning your home, washing your hands, which is important for us. Not coughing into the air is another thing. We are not sneezing into the air. If you do not have handkerchiefs or you do not have tissues that when you sneeze, you can throw them away. Or when you sneeze into them, when you get home, you can just use warm water and then wash them away. Then it's better to cough into your elbow so that you do not just spread the cough drops into the air. And so we as the public, we as the consumers, we as the general public, not the health experts, can still contribute immensely to this fight of antimicrobial resistance, such that when we actually need to be given an antibiotic, or an antimicrobial agent, when we are given, it would actually work for us. And when that happens, what that means is that we get to spend less at the hospital because we are spending less days being in the hospital. Mommy, if the child is the one who is sick, mommy gets to go to work, daddy gets to go to work early. You get to play with your friends as quickly as possible. And so that sickness phase does not drag on. These are the little things that we as the general public and consumers can do. Hand washing, ensuring that our environment is tidy and clean. Our personal person is clean. In cleaning, we should not just look at the larger surfaces, but let's look at the door handles, the doorknobs, our fridges, our microwaves, our air fryers, and of course, the everlasting intomago or rag that we use at home, so that we don't bring back what we want to discard out of our house. Thank you very much, and over to you, Enyonam.
Great, great, great. Thank you so much, Naana. In fact, very, very practical issues that are so close to us, some that are taken for granted. And you have clearly reminded us and opened our eyes to some of these issues. I think I do remember when the COVID pandemic came up, some health professionals kept saying that, do you know that this year, the incidence of cholera or the cases we are recording are very, very, you can't even see it. And it was attributed to a lot of the IPCs, the infection prevention and control. So it really has a place in our daily lives. Thank you so much, Naana. So at this moment, we zoom in straight to our Q&A session. And I think all the panelists will come back, and then all the presenters will be back, and then we could take your questions, and then they will do the justice that has to be done to our various questions. So can we have our panelists back, please? Thank you. So before we get any questions in the chat, I can't see any questions in the chat yet, but we do have some questions that have been thrown in already. This first question, any of you can answer. I think we take it from Prof. Let's give you the only male on the team, the first word. So the question says, why are antibiotics so vital for the developing world? Why are antibiotics so vital for the developing world? Prof will take this, and if there's any addition from any of the presenters, you are free to do so. Over to you, Prof. Thank you.
Thank you very, very, very much. Actually, not only for the developing world. Antibiotics are so vital for infectious diseases, which, accounts for significant number of deaths and significant ill health. But the problem is bigger in the developing countries. I mean, the problem of, the burden of infectious disease. I mean, if you look at death, it even affects our life expectancy, in the fact, the reason why there is disparity between life expectancy of those in the advanced countries and those in developing countries is because of infections. And antibiotics are, if we get it right, antibiotics really, it actually treats. So if you are sick with an infection, and we know the type of infection, and we give you the right antibiotic within days. In fact, sometimes, even in the day, from the morning to the evening, you see significant improvement. It works like magic. Maybe that's why sometimes people, want to abuse it. But it has to be used well, as has already been established here. If we misuse it, if we use it irrationally, that has been the problem of antimicrobial resistance, which is making infection treatment a nightmare, these days. So antibiotics are very, 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 very vital. It's actually life-saving essential medicine, because infections actually account for most of the ill health that we have, most of the deaths that we have, and it's also preventable, So antibiotics are very vital. Thank you.
Thank you very much. Please, any additions, or do we go to the next question? Okay, thank you. So there's a question, I think this one from Appiah will take it for us. It says that, do antibiotics help with common cold? Do antibiotics help with common cold? From Nanaya.
Right, so
Yes.
Nanaya,
Thank
right,
you.
okay.
We know that the common Can you hear me?
Yes,
Yeah.
you are very clear.
You know that the common cold is viral. So viral infections they resolve on their own. And so if you take antibiotics, it's not helpful at all. So cold infections are viral, they go away on their own. Antibiotics play no role. Antibiotics are particularly irrelevant in the common cold, and so they are not helpful at all. So when you take antibiotics for a common cold, you are just wasting your time as well as improving the risk of antimicrobial resistance. Thank you.
Thank you very much. So we heard it. Prof, did you also want to add something?
So I think Onaya has said it all.
Okay.
At best, but you said common cold. So if it's common cold, I mean, the virus that is responsible for common cold is just self-limiting, and you don't need antibiotics. You need some fluids, sometimes some vitamins, and you're well. Sometimes for some of the colds that are caused by viral infections, like some of the influenzas and things like that, at best you need an antiviral. All right, antibiotics are mostly used for bacteria infection, so you need an antiviral, except in instances where there is a secondary bacteria infection, which will be determined by the clinician. Then the antibiotics become important. So you don't need. None has said it all. You don't need antibiotics for common cold.
Thank you very much. Um, Someone is asking, should I throw my unused medications in the trash or down the toilet or the drain? From Francisca, will you take that for us?
Yeah. Yeah, I think disposal of antibiotics and any other medications, there are procedures that needs to be followed. There is a campaign that is being run by FDA where unused medications are supposed to be deposited at advantage points where they are collected and destroyed. When it comes to destruction of antibiotics, especially by individual disposing it in whatever, that's in itself can lead to microbial resistance. Let's take example. If the antimicrobial is just disposed into the environment, it gets into the soil, gets it into the water bodies, and then gets into plants, and then the food that we end up eating, you have residual antibiotics. Microorganisms that are in the soil also get exposed to it, and then they can also eventually become resistant. So those microorganisms, when they get to someone or when an individual gets infected with those antimicrobial organisms, it's actually from the right goal. It's a resistant microorganism that individual has been infected with. So disposal of antibiotics anywhere is not appropriate. The right channel has to be used for us to prevent development of resistance to this agent. Very important. FDA is leading a campaign. You can take your unused medication, including antibiotics, to any community pharmacy that is close to you, even hospital pharmacies. Let them know that you want to dispose them, and then they will use it. And please, 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 don't share this unused antibiotics with anybody, even yourself. It's possible the quantity that you have would not be appropriate to treat the infection that you would have. It's also possible that you could be having an infection with similar symptoms to what you were prescribed. It could be a different infection altogether. So very, very important. Don't use leftover antibiotics. And more importantly, try and use all your antibiotics that you are prescribed. When we do that, we end up winning fight the war against the microorganisms as we don't see, but they are seriously fighting us. Thank you.
Thank you
Thank
very
you.
much.
And can
Yes,
because
yes.
I think it's a fine opportunity. The FDA project is actually an active project that is ongoing. It is called Taking Back on Use and Expired Medicine. It's an initiative from FDA, and as a way of also minimizing the contamination of the environment with unused antimicrobials. Current research has shown that most of the pharmaceuticals that are actually dumped into the environment, the majority of them are antibiotics. And Francisca has explained, how that can also, be a contribution to the problem of antimicrobial resistance. So it is very, very important that unused antibiotics are safely disposed. Sometimes the liquid, some of them pour it into the sink, and then the capsules and tablets, they put it in the trash bin. It goes into the dump site, and it gets into the environment. A number of them gets into water bodies. There have been research on that, and we have seen residues of ciprofloxacin, metronidazole, penicillins, etc., etc. And this is quite worrying. It's also, contributing to the problem of antimicrobial resistance. So it's always important to safely, appropriately dispose of unused antibiotics. And I think that the FDA project that is ongoing is timely, as Francisca has said.
Thank you very much. So you've heard it all. When you cite the receptacle with the inscription TBUM, at any community pharmacy or any outlet where pharmacists work, you can dispose of your unused medications. You put them in there and the FDA will come for them. Thank you so much. I think now I'll come to you. You talked about IPC and then some hand sanitizers came. There's a question that do hand sanitizers cause antibiotic resistance? Nana.
Yes, thank you very much. Do hand sanitizers? Hand sanitizers are actually supposed to clear the germs off our hands or wherever that we are putting them in. And the rationale or how the mechanism that they work is they actually deactivate the germ from being harmful. So they are not causing antibiotic resistance because we are not using the medicine that the germ or the bug is going to be resistant to in when we do the hand sanitizers. Primarily, that's why I said that we should look at the alcohol hand wraps. They are just primarily supposed to clear the bad germs. Let's not forget that everybody has some good germs, and which is good. Naturally, they are supposed to be there, but the bad germs they are supposed to kill them off, and so they deactivate those germs for us. But that is not contributing to the antimicrobial resistance. No. But the best way to be sure that you've actually cleared off all those germs is to actually use soap and running water to wash your hands.
Thank you very much. And there's an addition from Prof. He says that if the concentration of the sanitizer is not right, the organism could develop resistance to the sanitizers. And that is why we recommend that you don't just buy any kind of hand sanitizers. I know that when you enter a community pharmacy, you get a good hand sanitizer. The hospitals have hospital grade hand sanitizers so that you can eradicate the organisms with the right concentration of the anti of the hand sanitizers. Yeah. So there's another question that says that when antimicrobials grow resistant in one system and are being transferred into another person, can these resistant microbials be treated by the initial antimicrobial that have become resistant to? In fact, it's a long one. I think the question is saying that if if an antimicrobial resistance has developed in someone, and then the person transfers the germs to another person, the newly infected person, can that person also become resistant to this particular antibiotic? I don't know whether the question sounds clear now.
Yeah, I can take that.
Francis.
Yeah,
Yes.
this usually, let's take a case of TB. It's a very clear example of that. TB is caused by a germ that attacks the lungs, makes the individual coughs. And treatment for TB is a very long, it's for a prolonged period and contains a lot of medication. So a lot of people tend not to take their medication right and then complete it. And this usually results in the germ that is causing the TB becoming resistant to the TB medication. TB is one of the infections that is freely given or distributed to people, because when you cough, when you sneeze, when you shout, when you laugh, even when you breathe, the germs comes out of your nostrils in droplets. So anyone that is around that inhale that droplet might eventually get infected, and then some of the infection will lead to diseases. So if the germ that you happens to inhale from someone happens to be the one that is resistant because the person did not take his or her medication well, that germ, though you haven't taken TB medication before, that germ will not even work when you are given that germ. The medicine for TB will not work against that germ. So that is the principle. And it actually applies to all infections, be it fungal infection, be it viral infection, be it other microbial, every infection. So a microorganism that is resistant to a particular medication, when a second person becomes infected with that germ, that medicine, though the person has never used it before, would never work. That is why it's very, very important. We have to fight against development of antimicrobial resistance, so that the little antimicrobial agents, the little antibiotics that we have, will be reserved for the next generation that will come, so that simple infections will not become a serious infection. Thank you.
Thank you very much. I saw Prof
Yeah,
also nodding.
I want to add, yeah, just something small. I mean, Francisca has really done justice to it. But usually, in some of these education, I've realized that sometimes people think that it is the individual that become resistant. It is not the individual that develop resistance. It is the microorganism that develop resistance to the medications, just like Francisca has explained. Because sometimes people think that, oh, this AMR, then I have become resistant. It is not the individual, right? Individuals rather are exposed to resistant microorganisms that, cause serious infections or threatens our life.
Thank you so, so much. And then the question here says that, so why can't we just make more antibiotics? You're saying we should reserve some for the generation unborn. Why can't we just make more antibiotics? Prof, I can see it. Nana, yeah.
Yes. That's a very, very good question. And I think that, I mean, he's right, but it is difficult, very expensive, and that's also more reason why we have to use what we are using very well. Secondly, as we have already established, the problem of infectious disease is highest in low and middle income countries, in poor countries. So when you spend money to develop antibiotics, people do not use it well. Within a short time, the organisms have become resistant and the antibiotic is useless. So it has really taken part of the problem. Taking a long time in introducing new antibiotics. The antibiotics that we have at the moment, some of them were introduced about 20, some of the latest ones, about 20 years ago. Within the last 20 years, it's recently that, people like Prof and other people are working to help us get new molecules into the system. Drug development is a very expensive venture. And when you develop molecules that organisms develop resistance to, it is not very profitable. People, the industry normally do not even want to spend time, money, developing antibiotics, except in recent time that there is some advocacy. But even if it is developed, we also have to take steps to ensure that we use it appropriately and minimize the risk of resistance. So, my friend, it is not that people don't want to produce antibiotics. It's people are developing antihypertensives, anti-diabetic medication, dyslipidemia. You make a lot of money, all right, from investing in this. These are for chronic, what they call it, chronic conditions. A lot more people are on it, no problem of resistance. But antibiotics, if you don't use it well within a short time, the organism develop resistance. Let me give an example. A drug like cefuroxime, Zenat, okay, when I started practice, it was a wonderful drug. And for most serious infections, including sepsis and all of that, you take Zenat and you get good outcomes. Zenat is very expensive now, and for a number of hospital acquired infections, it's not working because the organisms are resistant. Another example is Rosafen, ceftriaxone. I mean, what a wonder drug, but how it is becoming useless these days because of the problem of antimicrobial. So, who would want to, invest money in such an area? So that is the one of the issues.
Thank you very much. Thank you very, very much, Prof. Isaka Nelson has a question on. He says, how can we restrict? I think. Okay, from Nanaya. Okay, I was coming to you, so maybe I could ask the question, then you add it on. Is that okay?
Yes.
For us? Okay. So he says, how can we
Okay.
restrict the sale of antibiotics in our community pharmacies and over-the-counter medicine sellers? Because he thinks there is so much abuse. So please, after adding on, you can answer this question also. Thank you. From Nanaya.
Okay, thank you. I would like to, yes, can you hear me?
Yes, you are very audible.
Can you hear me, please?
Yes, you are audible. We can hear
All
you.
right.
Yes,
So, yes, okay. In solving a problem, there are solutions close, low-hanging solutions, and solutions that are out of our reach or not immediately accessible in terms of problem solving. So we use the multi-pronged approach, for example, how we are educating ourselves, how we are also educating the public. And we also know that our policymakers have put in place several policies to ensure that it's not easy to get antibiotics over the counter. But the thing is, it's a fight that we are fighting. So we have to use all the armory we have at our disposal. So in as much as we will ensure that our policymakers do the right thing, we will also empowering the community and letting everybody know that the decision is also up to you, the consumer, because of the information you have. Like someone said, when it comes to antimicrobial resistance, it's not somebody else's problem, it's not somebody else's solution. The solution comes from us, the health workers, us, the consumers, the policymakers. And so it is not somebody's problem to solve. We will do what we can from where we sit. But as my friend NSO Aboagye says, where you sit determines what you see. So how you see the problem is how you solve it, so that we can all move ahead and get out of this sketch within as short a time as possible. Thank you.
Thank you very much. And we have one,
Yeah.
I think this is the last question. Nana, you want to
Enyonam,
add something?
yes, I wanted
Okay.
to add to what the Isaka asked about the OTC and then the
Yeah.
community. The first thing,
Okay.
Isaka, you need to understand that it is illegal for any OTCM to sell antibiotics. Medicines are graded, and antibiotics are in a grade we call prescription-only medicines or pharmacist-initiated medicines. What that means is that you need a prescription to buy any antibiotic, or you need to go into a pharmacy, not an OTCM, a pharmacy, ask for a pharmacist. Tell the pharmacist what your issues are. And in the pharmacist, after the consultation with him, can then initiate an antibiotic or an antimicrobial for you. So the reason why we have that, as Nanaya previously said, is because we want it in everywhere, and we want it even in cosmetic shops. Antimicrobials, per the laws of Ghana, are only supposed to be gotten from community pharmacists. Dispensed, that is given to you, the consumer, the public, the patient, with a prescription, or after a discussion and a consultation with a pharmacist. So for those of us who also are of that clique, like Nanaya said, where you sit, you think that because you can afford a particular antibiotic, you enter into a pharmacy without a prescription and then you ask for it. That is also contributing to our antimicrobial resistance. So for the abuse, we all have to be each other's keeper, ensure that OTCM are not stocking antibiotics. We are not going there to pick our antimicrobials. We are using prescriptions, or we are speaking to our pharmacists in community pharmacy before we are giving antibiotics or antimicrobials for use. Thank you.
Thank you very much.
Thank you very much. In
Go
fact,
ahead.
this is a very, let me add this because it's very, very, very important. And I want to speak as a researcher. Now, the work that we have done over the years have shown that you are likely to, get antibiotic that is expired. You are likely to get, antibiotic that is not, appropriately stored. You are likely to get what they call inadequate dosage of antibiotics. All right. When you go and purchase antibiotics from OTMC. One, because the what they call it, the people in there do not have adequate knowledge about the product to even be able to advise on the right way of using it. I mean, and I'm speaking to scientific evidence on this. And I also want to make a passionate appeal to all the wholesalers who have been supplying, antibiotics to the OT. I mean, I think they are doing a very, very, they are doing us a serious disservice, because we have actually collected data and realized that most of the people who go to the OTMs, they get the wrong antibiotics, they get the wrong, treatment, for the antibiotics. They use the antibiotics for conditions that they do not have. And also the pharmacies, let me also use this to also make a passionate appeal to the pharmacies. These are very important. These antibiotics are class A drugs, and they are supposed to be supplied, when there is a need for it. And under no circumstance should somebody use an antibiotic when he does not need it. It's part of the problem of antimicrobial resistance. Pharmacists should ensure that they have the right cadre of professionals within the outlets. And then, as Nana said, legally supplying these important medicines in the right way, and rather meeting the needs of the people. That is the reason why we have been given the licenses, right? We are supposed to protect the public. We are supposed to contribute to the health of the population. Make sure that antibiotics are supplied in the right way with appropriate information, so that the patient will get the best, out of it. Thank you very much.
Thank you very much. I will just read a few comments before our last question. Someone says, Kingsley Nyako, he says we need a massive public
Please,
education on
just to add, I like.
Yes, Nanaya, please go ahead. Yes, Nanaya, go ahead, please.
Yes, just to take it up from what Kingsley Nyako is saying. Yes, I think we as a cadre of healthcare professionals need to do much more than we're doing now in terms of creating the awareness, because research has shown that the public doesn't fully understand what the issues are in relation to the antimicrobial resistance and the dangers it comes with. And so, like Kingsley is asking, the massive education on antimicrobials, election season is coming. So we need to find out what these politicians who think they can solve everybody's problem, what their views are on issues like this when it comes to health. Because we need to be very aggressive in terms of our advocacy. Because when COVID happened, it was no respecter of persons. So we can't just sit and, like we say, we need to be very aggressive as cadres of and people who are what would we say it, people who hold the medicines, because like Nana said, there are other cadres that are not supposed to be in custody of the certain categories of medicines. But in as much as it hurts to say that this is Ghana, it's we know what is going on out there. That is why personally I think the focus must, in terms of low hanging fruit, we must put the power into the hands of the consumer in terms of education for them to know what is right and wrong and the impact of decisions they make, so that they vote with their hands and then they vote with their money in terms of whatever decisions they make concerning medicine choices and medicine use.
Thank you very much, Nanaya Pharm. I will pose the last question, though I think we can't continue for too long. It's engaging, but the show must be brought to an end at a point. Someone is asking, Edwin says that, is there a role for herbal preparations? I think this question from Buabeng and then Prof. Buabeng and then Dr. Francis, you can look at it. Each of you can answer, or any of you can answer. Says, do herbal preparations have a role in contributing to antimicrobial resistance? And then what role do they have? Thank you. This was the
Good.
question.
Very good question. Very, very, very good question. And if you look at the strategic objective of the National Action Plan, all right, the last objective is to make economic case, and also what they call it, look for innovations, right, or solutions from other sources. And one of the main areas that the whole world is looking in terms of drug discovery is herbs. I mean, if you go into history, many of the drugs that we have now, we can trace their roots, into herbs. But it's not just, having said that, you can just, jump on any herb and use any herb, and all of that. It has to be backed by that. Some is being done by some of the scientists, and they've been able to identify, in fact, some lead molecule from herbal sources. One of them is onion, and then not just onion, but the garlic, onion, those species. Very, very, very promising, and I'll not be surprised that in future we'll be talking about having found solution to multi-drug resistant TB from some of those what they call it molecules. Recently, we did a clinical trial with the Nibima, which is an anti-malarial what they call it drug. Again, following science has been proven effective against malaria. The product in there from herbal source cryptolepin, has been scientifically worked on, very, very effective against anti-malaria. But we also saw that it has activity against what they call some viruses, including the hepatitis B virus. This was a very good scientific work that was done in the KNUST Department of Microbiology. And then also, we also found it to have some anti-COVID properties. We actually took it through clinical trials, and it was very interesting. So what we did was that we actually looked at people with moderate and severe infections who were on COVID medications, and we gave the Nibima as an adjunct, and we compared it against those who were taking the convection treatment. And the proportion of the patients that died, all right, we had five, what do you call it, 5 people dying, all right, on the arm that did not have Nibima, and only one person dying on the arm that had Nibima. We also had, saw significant reduction in terms of the symptoms. I mean, people recovered, what they call it. The unfortunate thing is that we could not get enough. At the time that we got the approval to conduct the trials, the cases had gone down. So we had only 18 cases. But we saw this. So Nibima did not worsen, the health, together with the conventional, drug, did not worsen the health of those that had COVID, but rather, it continued to improvement. It's a pure herb, all right? And it provided synergy, with the conventional treatment. So there is a role for herbal medicine, but it has to be backed, by science. And those who also listen to the inaugural lecture of Professor Christian Ejari, the provost of the College of Health Science, he has done a lot of work in this area. So there is a promise. We need to continue to invest in there. I think we may get some solutions.
Wonderful.
To add a little to that, yes, herbal medications actually have a role in antimicrobial fight against microorganisms. But the issue that exists has to do with standardization of those herbal medications that are used. If we are not able to standardize the dose that is effective, we would also end up actually causing resistance to this agent. So I think it's the reason why we have the research for plants and the one in Eastern region that actually helps in standardizing the dose of this herbal medication. Those ones are approved because they have been tested, tried, and know that yes, when you take this volume as indicated, you get the required amount of medication that is. But in situation where you sit at home, add your 1, 2, 3 together, and then you take it, that is where the danger would start coming from. The chances that you are underdosing those herbal medications are high, and when that happens, resistance will surely set in. So herbal medication have a very significant role in fight against antimicrobial, but we have to look at how the dose is standardized. Thank you.
And again, since we are talking to the public, this is also very, very important because people just use any herb anyhow and all of that. It is not every herb that has antimicrobial activity. As we said, it has to be proven by science. We need to, investigate. He's talked about the work that Mampo is doing, and other scientists are also doing. Another thing which is happening, people are putting herbs in wounds, and it is destroying. It's making the wounds worse. We see this in the community pharmacies a lot of the times. If you put herbs, and sometimes they just grind it and you are putting dirt into the wounds. You would increase the risk, the chance of infection in the wound, and it does happen a lot. And the wound become worse. Some people have lost their fingers and their legs because of such practices. So we should desist from applying herbal concoctions and all kinds of things into open wounds and things like that. We can only make it worse. And we are not saying every herb. We are saying that herbs that have been found to have activity and used in the right way scientifically. That is what we are saying.
Thank you. Scientific evidence to back what we use. We have to just end here. I will quickly read a few comments. Yes, a lot of engagement on the platform. Says good presentation, great presentations. Emmanuel Nyaku says the presentations are wonderful from our panelists. And I see, yeah, that's Mobachi. Thanks for being here and supporting. Somebody says great in fact, a lot of people are saying great presentations. Hey, Prof. Shaku. Prof. Shaku says hi, neighbor. Prof. Buabeng. So we are seeing
Neighbor!
So Tabate says yes, he's supporting what he said, Nana. He says our bathroom towels, which we use to wipe our bodies after bathing. In fact, after long use of these towels, without washing them, the things on them become very loaded. The bacteria becomes very loaded. And Edward Ajiman says, you like to hear more of these presentations to educate the public. Good job. Yakubu Achulo says, good presentations. In fact, a lot of people are happy with the presentation. Senam says, I forgot to mention this. Thank you for bringing this up, Prof. And Nana, that we have to wash our hands when we rub our hands with disinfectants. And then we so that we do, and when we use that, so that we don't have any. I think it didn't end. I didn't get the full thing, but she only wants to thank you, or he or she wants to thank you for bringing this up. I think at this point, we will just have the wrapping up comments, just under 1 second for each of you, so that we invite Pharm, Yvvonne, Esseku to give us the closing remarks. If you have any comments to wrap up, then I'll go from Prof, and I'll come to Francie, and then Nana will finish it up. Thank you.
I think we've said enough, so I'll defer to my other.
Thank you. Thank you. Anything else? Francie, do you have anything to say? Have we finished all our wrap up?
Resistance is real. Antimicrobial resistance is real. It's a time bomb that we are sitting on, and we have to do anything within us to be able to deflate this. If not, we would actually have a big fight in the future. Thank you.
Thank you. Nana, do you have your final comments?
Yes, I just want to tell the public that the power is theirs. They should also get to know, and anytime they enter into a community pharmacy, they should ask for the pharmacist and get the right antimicrobial agents that they need, and then they'll be told exactly how to use it, where to use it, and when to use it. It is as important as you having the money to buy it. And so let's keep on educating ourselves, and hopefully we would be able to beat antimicrobial resistance. Thank you.
Thank you very much. So we will continue to take any further questions on the social media handles that are displayed on the flyers, and that will be placed in the chat box, so that if you have any further questions, you can continue bringing them in and they will be addressed appropriately. So at this moment, I'll call on the rector of the Ghana College of Pharmacists, Pharm Dr. Yvvonne Esseku Esquire, to give us the closing remarks.
Thank you so much. I mean, the engagement is so great. It is wonderful to hear the excitement and the request for more engagement. And so I think that as rector of the Ghana College of Pharmacists, I can pledge on behalf of the college that we will get these sets of education programs rolling. We will bring them to you. We will get you more informed so that you can make informed decisions. And all of us together can contribute in this fight against antimicrobial resistance. Thank you so much, all of you, for joining. Thank you for the how engaged it is. Yes, yeah, gross on an ideas and for. And so those of us in the in the places where we do not know whether the lights will go off or not, we have to finish up and wrap up quickly so that we can all get the benefit. But as Pharmacist Enyonam has mentioned to us, we will get all the, if there were comments, if there were questions that were not addressed, we'll put them all together. And indeed, the questions that were addressed, we will still compile them, get them to you with the answers. And I'm sure that for those of you, you use our various social media handles to get onto this conversation. And so we will use those handles as well to get back to you and communicate with you throughout the coming year until, God willing, we meet again next year. And hopefully next year we'll have better news to share, and we'll be talking about how progress is being steadily made. So thank you once again for coming, and I'll hand over back to our moderator.
Thank you very much, Madam Rector. I'm always excited to hear her voice because it's full of life. Thank you so much, our audience. Thank you for contributing. Thank you for listening in. Thank you for your participation. We thank you, all our facilitators from Buabeng, from Naana, Appiah, Dr. Francisca Zigah, and from Naana, Afia, Aboagye-Asare. CES, we are very grateful. The Ghana College of Pharmacists and our proud support WHO. And I will quote the theme again, that WHO says, we are preventing antimicrobial resistance together because it is a threat that affects all of us. We have been very much informed, we've been empowered, and we'll go all out and be ambassadors to help stem this menace. Thank you all very much for being part of this evening session. And until any other next session, we hope when you see our social media handles and all the adverts running, you quickly log in and join us and let it be as engaging as it has been this evening. We are very, very grateful to you all and enjoy your evening. Thank you so much. It's been